Welcome to Wichita's Biz That Is on KGPT. I'm Tim Witzman, president of the Wichita Independent Business Association, and today we have a guest who's a real friend of mine. Ann Nelson is it director? Is that
Executive Director.
Executive Director of the Central Plains Healthcare Partnership. And that really includes Project Access, does it not?
Yes, it does.
Okay. Well, let's find out a little about Ann. Where did you begin and kind of your journey to the Central Plains Partnership? Yeah.
Well, I grew up in Wichita, and my children are fifth generation Kansans, so I'm really proud of that. So grew up in Wichita, went to Wichita State University, got my degree in psychology, went on to Friends University for a master's degree in marriage and family therapy, and thought I would spend my career doing therapy, and didn't end up doing that. I spent about 15 years working in child welfare and heard about this wonderful new program that was getting started to serve uninsured people. It was a great blend of medicine and social services. So I applied, had the honor of getting that job, and for the last 15 years I've been managing Central Plains and the Project Access program.
Well, the only thing and all that scared me was the psychology part, because that means you've been analyzing me the whole time we've known each other.
No.
Oh, and
no,
like,
absolutely not.
Cringe went down my back.
You're a great guy, and we are very good friends.
Oh, we are. And one of the reasons, the way we met partly was through these attempts to provide more access to medical care.
Yes, for uninsured people.
For uninsured people.
Yes.
You want to talk about some of those things, because some of them have been blind alleys for us, unfortunately, and some have paid off, and you've managed to get some things done.
Well, our most recent work together was to try and initiate in Kansas a nonprofit health insurance cooperative, and that ended up not working for a variety of reasons, mostly because Congress swept the funds that we were hoping to leverage for that new initiative.
In the fiscal cliff bailout.
Yes, exactly.
In order to protect our good friends in Hollywood and NASCAR.
That is where the money went.
That is where the money went,
as well
to continue
as other
credits for them.
Yes.
And it might be because you and I, Ann, just don't make large enough contributions, and some of those others
Perhaps
do.
that's it. I don't know. I will say it was a huge disappointment, because we built a wonderful plan that I think could have been very successful.
And the idea was that we were going to try to get to more people in the state.
Yes.
And provide some alternatives, because in this state there isn't much competition, as there isn't in a lot of states, particularly here where you have low populations.
I agree. There isn't a lot of competition in insurance, in the insurance field. We also had hoped to cover thousands of uninsured people that remain uninsured. There are 65,000 uninsured adults that reside right here in Sedgwick County. That's 3 times the population of Derby. It would fill the Entrust Arena 4 times. There are a lot of uninsured people here. Now, another program that has been more successful is Project Access.
Right.
Which is a program that we coordinate.
Talk about Project Access. It's really worthy, and it's one of those good stories about people doing the right things.
Well, I appreciate you saying that. Thank you. Project Access coordinates donated medical care for uninsured, hardworking people in our community. We have 630 physicians who've agreed to participate.
Now, people don't always appreciate the fact that physicians will do those things. I mean, you read about the Doctors Without Borders and some of the overseas things, but don't always see things that are local.
My experience with the medical community here in Wichita is that they're very generous, quietly giving of their time and talent. They're not interested in a lot of attention or thank yous for that. They just very quietly give their care to those who need it. So Project Access is an opportunity for them to take care of the uninsured and to pay it forward.
How does that sort of interface with things like the clinics?
The community clinics, they are enrollment sites for Project Access.
Okay.
About 50% of our patients get enrolled there. When there is some kind of medical need that an uninsured person has that's beyond the scope of the clinic to provide in their primary care settings, those patients can get enrolled in Project Access if they're eligible, and then they can access the continuum of donated care that we coordinate. Physicians, hospitals, dentists, physical therapists, hospice care. We manage a full network volunteer providers.
Do you have more difficulty finding specialists or GPs? And that's an old term, but
General practitioners
are more
that's still
common?
used today. About, I'd say 75% of the physicians that participate in our program actually are specialists.
Oh,
and the
really?
other 25% are primary care doctors.
I'm surprised.
That's the need. When a woman at Guadalupe Clinic has a breast lump and needs to see a breast surgeon, we can enroll her and refer her out. That physician care, the surgical care, the hospital care is all donated on her behalf. She can fill prescriptions because we have a medication program with city and county funds and get the care she needs and return back to Guadalupe for her ongoing primary care. People enroll in our program for about 6 months unless they have ongoing conditions, and we can extend their enrollments.
And tell me about the funding for Project Access. I mean, you've got a lot of dedicated and free work coming from the physicians
Yes.
and dentists,
$17.5 million a year in medical care is donated.
Wow.
Our funding base is the United Way of the Plains, the City of Wichita, Community Service Block Grant Funds, and Sedgwick County.
Okay.
And then we pursue grants and foundations, and we have other donors, private donors, who give to the program.
So how much, that's interesting, with all that donated work, what's the ratio of that to the dollars that are put in?
I just told county commissioners the other day that every dollar just that the county contributes or contributed last year leverages $79 as a return on their investment. The vast majority of our budget is the donated care that we are audited against. Those are considered real dollars.
That's a great place to take our first break
Okay.
on Wichita's Biz That Is.